Yeah, there are different results. It's, in the situation of bevacizumab, in first line, the development has been only in non-squamous histology due to the fact that the phase 2 trials show hemoptysis in patients with squamous cell carcinoma. In the case of nintedanib, in the randomized trial comparing nintedanib plus docetaxel or nintedanib plus placebo, there are differences in overall survival for the subgroup of adenocarcinoma, but not for the subgroup of squamous cell carcinoma. This is different in the study of the REBEL trial, the ramucirumab trial. Both subgroups benefited from the addition of ramucirumab, non-squamous and squamous, and the toxicity was not different between the two histological subgroups.
Both of the strategies are active to control non-small cell lung cancer. However, they are different. One strategy is binding the ligand, the other strategy is binding the receptor. We have one clinical aspect that can explain this situation, that as ramucirumab is the only drug active both in squamous and in non-squamous. And we know that VEGFR2 maybe is the key receptor of all the process of angiogenesis. So maybe targeting the VEGF receptor 2 can be a more active strategy. But it's only an idea. There are no clear data on that.
The ramucirumab is blocking the VEGFR2 receptor, while, for instance, bevacizumab works on VEGF, circulating VEGF. So you block it at the cell level with the ramucirumab. And we don't know exactly what are the differences, but we see differences in how it works and how it can also be effective beyond its effect on the tumor cell. So let's look at myeloid cells, so the immunosuppressive cells, which can also become endothelial cells, but they also have this receptor on their surface. So besides the effect directly on tumor growth or tumor cells or the endothelial cells, it also has an effect on the immune system. Ramucirumab is a VEGFR2 blocker. It blocks the receptor there, and we have to keep in mind that all different kind of VEGF, anti-angiogenic agents, all have a different way of acting on the endothelial cells, but also on other cells. So this VEGFR2 receptor is, for instance, also present on immune cells. So it could be that by blocking this, you also have an effect on the immunosuppressive cells, and that besides the effect on the blood vessels on the endothelial cells, you also have an effect on the immune system with this agent.
Well, the ramucirumab, is VEGFR2 receptor inhibitor, so it's working on the receptor as opposed to bevacizumab and other agents that trap the circulating ligand. Sure, I think it can work differently because it's blocking the receptor activation at the tumor cell. It might have a direct effect on the tumor cell, a more direct effect because of its mechanism working on that receptor, both on the tumor cell and the endothelial cell. It can work on the receptor on both. So I think you could hypothesize that a VEGFR2 antibody is having an effect both on the tumor and the microenvironment and could be more potent. One thing I always worried about with and many worry about with the VEGF sort of trap approach, which binding up the ligand, is you might not have as complete an inhibition as well.